All right, guys, welcome back to the Fountain of Truth. My name is Nick, and today I just wanted to talk about metabolic health and its connection to COVID-19 severity. I think it's a really overlooked topic in general. I mean, we all know about the comorbidities and how it affects, and how COVID-19 affects people with comorbidities, but not a lot of people are talking about ways to actually improve your metabolic health and really just how bad it is and how important it is to fix your vitamin D levels, get adequate fat soluble vitamins, and then fix your insulin resistance. So I just wanted to run through some studies with you guys and a couple articles. For the most part, I'm probably preaching to the choir. Most people tend to agree on this subject that we all need to eat healthier, but a lot of people know it, but not many people are implementing it. So that's why I'm making this video. So let's start really with this study right here. So individuals with obesity and COVID-19, a global perspective on the epidemiology and biological relationships. It's a really in-depth study, kind of just basically looking at epidemiological evidence that, correlation of obesity and COVID-19 severity in pooled analysis. Pooled analysis shows individuals with obesity were more at risk for COVID-19 positives. Also for ICU admissions, just showing in general people that were obese tended to actually get COVID-19 at a higher rate, and then also suffered worse conditions, ended up in the hospital. And then also we already know that obesity extends the duration of influenza A virus shedding. So when it comes to influenza-like illnesses, and yes, coronaviruses are influenza-like illnesses, obesity will extend the duration of the actual shedding. So the more obese you are, the more contagious you are. So, when we talk about ways that we can protect the community, if we're going to talk about masks, social distancing, washing your hands, and vaccines, we should also include having a healthy BMI, because that is the way to keep your community safe too. So we should be encouraging people to eat better and exercise. This one also, association of blood glucose control and the outcomes of patients with COVID-19 and pre-existing type 2 diabetes. This one's a really popular image that's been, going around the internet. Look at this. So people with well-controlled blood glucose had a 98.9% survival rate versus people with well-controlled blood glucose. People that had blood sugar swings and were not controlling their blood sugar and their insulin levels had a much higher death rate, had a survival rate of what's looking like 11%. Like, it's terrible. So I think that's another thing we need to keep in mind. And then, what we kind of hear about in general also is vitamin D levels, the impact on vitamin D. Vitamin D also does affect insulin sensitivity. And, it's really the discussion of the debate is a matter of whether the virus lowers your vitamin D levels or whether low vitamin D levels make you more susceptible to the virus. I think it could be a little bit of both, in my opinion. I think having low vitamin D, I mean, most people do have low vitamin D anyway, makes you weaker. The pooled analysis shows that individuals with vitamin D deficiency were 80% more likely to acquire COVID-19 infection as compared to those who have sufficient vitamin D levels. I mean, you can't misinterpret that. That's pretty clear right there. Another study showing the association of vitamin K and D deficiencies associated with COVID-19 disease severity. As a lot of you know, vitamin D and vitamin K are they work together to metabolize calcium, which is one of the most overlooked things in regards to health as well. Fat soluble vitamins, vitamins A, D, E, K2 are super important for just basic bodily functions and just living your normal life when it comes to gene expression and cell differentiation. And then also vitamin D and vitamin K2 are responsible for calcium metabolization. Essentially, vitamin D is responsible for absorbing the calcium. Vitamin K2 is responsible for depositing it where it needs to go. So, I mean, we're even finding that, mainstream media is covering that as well. Vitamin D found in some cheeses could help fight against COVID-19. They're finding that areas of Japan that were eating high amounts of natto, which is a fermented soybean product, very high in vitamin K2. They had like no deaths, at least at the time of this article was written. They had no deaths from COVID-19, and I believe this was written last year. Yeah, it's a year old. But still, they're at least acknowledging that and vitamin D and vitamin K2 work hand in hand. So vitamin D is been shown to help the outcome, or having sufficient vitamin D gives you a better outcome when it comes to COVID-19. It makes sense that vitamin K2 would also play a role. Reduced vitamin K status as a potentially modifiable risk factor of severe COVID-19. So I mean, like, we're seeing it. I mean, even Harvard is addressing, or Cambridge, I'm sorry. Even Cambridge is addressing it. Vitamin K. This one gets into the actual mechanisms involved. It's really in depth, how it's metabolized, what it does. It gets into all the biochemistry and how it could potentially be helping with COVID-19. Again, none of this is, I'm just showing you guys evidence. I'm not over here like trying to actually give you guys medical advice. I'm not a doctor or anything like that. So I'm just looking at the scientific evidence to try to encourage people to live a healthier life, to manage their blood sugar, to get adequate vitamin D, to get out in the sun, to exercise, and we all know that comorbidities plays a huge role in COVID-19 severity, but not many people are actually talking about the mechanisms involved and what they can actually do. So in my next video, I want to actually talk about how people can fix their metabolic health. So that this video, I'm showing the importance of your metabolic health and how it actually will contribute to better outcomes with COVID-19. My next video is going to be about how we can actually address fixing insulin resistance, getting adequate vitamins and minerals, and getting your fat soluble vitamins, and building your immune system. So I appreciate everyone that tuned into this one, and I got another one coming for you guys soon. Thanks. Have a good one.